Padmashri Dr. Shivanti Adityanar College of Nursing, Tiruchendur, under its Child Health Nursing Department, happy to present this World Pneumonia Day. That is, every year, 12th November is celebrating as a World Pneumonia Day. The world to stand together and demand the action in the fight against pneumonia. Pneumonia is a preventable and treatable disease that sickens 155 million children under 5 and kills 1.6 million each year. This makes pneumonia the number one killer of children under 5, claiming more lives in this age group than AIDS, malaria, and measles combined. Pneumonia is the single biggest infectious killer of adults and children, claiming the lives of 2.5 million, including 6,72,000 children in 2019. This year, World Pneumonia Day on 12th November 2020 will be held during the global pandemic that is dramatically increasing pneumonia deaths from COVID 19 and other causes. COVID 19 could add 1.9 million to the death toll this year. This could increase all cause pneumonia deaths by more than 75%. No other infection caused this burden of death. Disruption to healthcare services are estimated to cause up to an additional 2.3 million child deaths, 35% from pneumonia and newborn sepsis. Many countries across Africa, Asia, and Latin America struggling with heavy burden of COVID-19 and child pneumonia deaths will need effective strategies to fight both. Investment in infection prevention like masks, social distancing, hand washing, etc. and improve the diagnosis and treatment like pulse oximeter and oxygen can save the lives during the pandemic and beyond. Definition of pneumonia. Pneumonia is an infection that inflames the air sacs in one or both lungs. Causes of pneumonia. Virus, that is flu virus, cold viruses, RSV virus. So this cause for the newborn babies at age 1 year or younger. Coronavirus 2019 may cause the pneumonia. Bacteria like is called Streptococcus pneumonia and Mycoplasma pneumoniae. Fungi, the fungi that cause it can be found in soil or bird, dropping and vary depending upon the geographic location. Aspiration pneumonia. Aspiration pneumonia occurs when you inhale food, drink, vomit, or saliva into your lungs. Risk factors. Children who are 2 years old or younger, people who are age 65 or older, others it includes if you are in a hospital intensive care unit, especially if you are on a machine that is ventilator that helps you breathe. If you have asthma, chronic obstructive pulmonary disease or heart disease, smoking damages your body's natural defenses against the bacteria and viruses that cause pneumonia. Weakened or suppressed immune system, people who have HIV, AIDS, who have had an organ transplant, who receive the chemotherapy or long-term steroids are at risk. Symptoms of pneumonia. Depending on what causing your pneumonia, your age and your health. Common pneumonia symptoms include chest pain when you breathe or cough that produce mucus, fatigue and loss of appetite, fever, sweating and chills, nausea, vomiting and diarrhea, shortness of breath. Symptoms for children. Newborn and infants may not show any sign of infection, or they might vomit, have a fever, and have a cough, and seems restless or tired. If you have new cough, fever, or shortness of breath, call your doctor to ask about whether it could be COVID 19. Illness with the new coronavirus can also lead pneumonia. Diagnosis. Blood tests to look for sign of bacterial infection a chest x-ray to find the infection in your lungs and how far it spread, pulse oximeter to measure the level of oxygen in your blood, a sputum test to check the fluid in your lungs for the of an infection, bronchoscopy to check airways for blockage or other problem, a CT scan to get a more detailed image of your lungs. Pneumonia treatment, your doctor can tell you which treatment is right for you. If you have a bacterial pneumonia, you will get antibiotics. Make sure you take all of the medicines your doctor gives you, even if you start to feel better before you are through with it. If you have a viral pneumonia, antibiotics won't help. You will need to rest, drink a lot of fluids, and take medicines for your fever. With any kind of pneumonia, recovery will take time. You are going to need a lot of rest. You might need a week of your usual routines, and you could still feel tired for a month. The home remedies for pneumonia, there is a diet of juices, tea with fenugreek seeds, garlic, parsnip juice, carrot juice, juice of holy basil leaves. Possible complication of pneumonia in a child, severe breathing problem, bacteria that enters the blood. Then pneumococcal vaccine, that's it should be the preventive measure. Infant gets pneumococcal vaccine 13 immunization as a series of 4 injection. The first dosage at 2 months of age, the second the following dosage 4 months, 6 months and 12 to 15 months. Adults who need this vaccine only get one shot. The vaccine helps protect against the 13 type of pneumococcal bacteria that most commonly cause serious infection in children and adults. World Pneumonia Day. Let's increase access to medical oxygen. Oxygen has always been an essential medicine. COVID 19 is teaching the world just how essential. This World Pneumonia Day, let's all agree to work more effectively to increase access to medical oxygen. This World Pneumonia Day, we are calling on governments and other stakeholders to ensure that the massive effort to control the pandemic contributes to reducing all cause respiratory infection and deaths among both children and adults for the long term. Thank you.